The Kent Center operates an emergency services program that is available 24/7 to respond to the needs of the community. The Emergency Services Program has 4 different programs to serve the community: the Kent Hospital Emergency Room, Community-Based Crisis Intervention and Response, Kent County Courthouse Services, and Special Services for Veterans and Women. Master's level Kent Center clinicians are located on site at the Kent Hospital Emergency Room. Individuals who present at the emergency room with an acute behavioral health need or who appear to be experiencing a psychiatric or substance abuse crisis are referred to Kent Center staff by the treating physician at the Kent Hospital Emergency Room. The Kent Center clinician provides a thorough assessment of the person's needs and develops an appropriate plan of care. The clinician calls upon natural and community supports to develop the plan, which may include discharge to home with a referral to services, inpatient behavioral health admission, or referral back to the client's current treating provider based on assessed need. The clinician works to facilitate appropriate referrals for the client and family to ensure a safe discharge from the emergency room back to the home or other setting. If a provider sends a client to the emergency room for an acute behavioral health issue, the provider can contact the Kent Center's Emergency Services line at 401-738-4300 to coordinate care. Our Emergency Services Community-Based Crisis Intervention Program is designed to meet the immediate behavioral health needs of individuals and families experiencing a behavioral health crisis. Our master's level clinicians provide telephone triage and consultation as well as home, office, or community-based crisis assessment and linkage to services to assist the individual or family in safely managing the crisis situation. Staff work closely with law enforcement, families, and other community or natural supports to ensure the individual is either maintained safely in the community or transitioned to a more intensive treatment setting, such as an inpatient admission. Crisis intervention services may be accessed by calling the Kent Center's Emergency Services line at 401-738-4300. Kent Center Master's Level clinicians are also on site at the Kent County Courthouse. Our clinicians provide initial behavioral health evaluations and referrals for individuals who appear for a court hearing and whose legal issues are suspected to be related to mental health issues or whose psychiatric symptoms impact his or her ability to participate fully in the court proceedings. Our clinicians receive referrals from judges, attorneys, probation officers, or other staff for an assessment. Our clinicians then provide recommendations to the court based on their assessment. This service is instrumental in identifying individuals with mental illness whose symptoms would have otherwise gone untreated. Kent Center Master's Level clinicians, as part of their work at the courthouse, have a particular focus on women and veterans through a Rhode Island Department of Behavioral Health Care, Developmental Disabilities, and Hospitals grant-funded program called the Rhode Island Alternatives to Sentencing and Trauma Recovery. Veterans and women whose issues appear to be trauma-related are referred to Kent Center clinicians for evaluation and referrals. The Kent Center is able to offer women and veterans educational groups to assist them in understanding the role of trauma in their behaviors, as well as to teach the necessary skills to effectively self-manage these issues.